To give some examples of how we've helped patients and greater communities, obviously, to improve patient care and outcome, we've had thousands of visitors and hundreds of messages to our website and through our social media platforms. And this obviously helps improve patient care because patients are choosing a qualified surgeon and they're choosing a accredited facility to have surgery in a hospital as opposed to a house or an office suite that's not accredited. And we've had some really, really sad stories. One lady could actually feel when her breast was being reconstructed and she was having surgery in a fibro house. And this is in New South Wales, so it's quite unheard of that this sort of practice goes on, but it does. The HCCC are obviously now looking into it after years of complaints both from doctors, surgeons and patients. However, it's still a reality and there are still surgeons who operate without appropriate qualifications or the appropriate accredited facilities. Patients are lured to these surgeons by different marketing tactics and price point. We are not only helping patients achieve a better outcome by encouraging them and educating them on the difference between a plastic and cosmetic physician who is not does not have any formal qualifications or a member of any professional body, but we help individuals. So one individual who came to us had been walking around for 2 years with only one breast. She didn't care anymore about aesthetics. Obviously, post having children, initially she did get implants for a better aesthetic appearance, but by the end of her journey, she was just exhausted. Not only did she get that other implant removed, but that cost money on our public health system because had she not been able to go through us, she wouldn't have been able to get it removed at all, and there's a psychological impact onto the health system. But had she not been able to get it removed through a specialist plastic surgeon through the public system, she would have had to pay, and she didn't have the money to pay. So Medicare, obviously, it comes back to. So by us raising awareness and promoting qualified surgeons, we're saving lots of dollars, lots of money, lots of taxpayers' money because patients aren't making these poor choices and poor decisions. But we're also helping these individuals who do have surgery overseas or have surgery in an unaccredited facility with a doctor who is just that, who is a doctor without any formal qualifications. We have lots of stories, and there are quite a few who are currently working really hard to raise the standard, not only within New South Wales but across the country, and hopefully the HCCC will tighten regulations to make it more difficult for people to practice who are not qualified to do so, or to operate in a facility which is not accredited. But even so, there's still going to be patients who will choose to go overseas because it's accessible, and we're the only person who's helping them when they come back. So we're helping in multiple facets.